Hello everyone, this is Shaktiel pursuing final year BPT at SNS College of Physiotherapy. In this video we are going to see about some stretches which will be useful for your gym. Let's dive into the stretches. Firstly, we are going to see about the wrist flexor stretch. The position of the patient is high sitting. The elbow is in full extension and the wrist will be in extension. The patient is asked to fully extend the wrist with fingers. Then he will feel the stretch in the flexor of the forearm. Have you feel any stretch? Hold it for 10 to 20 seconds for 5 sets. Next we are going to move the second stretch. We are going to see, that is forearm extensor stretch. Same like flexor but in inverted position. Same as elbow in full extension and the wrist to be in flexion and fingers are in extension. The patient will feel the stretch in the extensor of forearm. Can you feel the stretch? As like wrist flexor stretch, 10 to 20 seconds hold will be there. 3 to 5 sets is preferable. Third stretch is biceps brachii stretch. The muscle is in the forearm. Third stretch we are going to see, that is biceps brachii stretch. The patient is in high sitting position. The patient is asked to extend the shoulder up to the maximal range and palm should be faced to be upward. The patient will feel the stretch in the anterior aspect of the arm. The hold as same as before, 10 to 20 seconds. 3 to 5 sets are preferable. Then we are moving on to fourth muscle, that is triceps brachii. The patient is asked to fully flex the shoulder up to the maximal range and the patient is asked to pull the elbow to feel the further maximal stretch of the triceps brachii. As same as previous, 10 to 20 seconds are preferable. 3 to 5 sets are also included. Next we move on to trapezius muscle stretch. The patient is asked to sit on the high sitting position. You can sit. We are first concentrate on right side of trapezius. The patient is asked to hold the couch on ipsilateral side and asked to flex the neck. For maximal stretch, ask the patient to hold another hand for maximal stretch. This is for upper fibers of trapezius. Okay. Next we move on to pectoralis major muscle stretch. The patient is asked to grasp the hand behind the occiput and passively extend the arm. Should be result in the stretch of pectoralis major muscle. The hold is about 10 to 20 seconds. 3 to 5 sets are preferable. Next we move on to iliopsoas muscle stretch. The patient is asked to lie on the couch with extend up to the hip. On the hip. Then the patient is asked to flex the hip on opposite side. Then asked to hold the whole lower limb and the patient is asked to fully flex the lower limb with the support of upper limb. Passive flexion towards the chest results in the stretching of iliopsoas muscle. The repetition is about 10 to 20 seconds hold. For 3 to 5 sets are preferable. Next we are moving on to a special stretch which will be used for sports players to prevent injuries in the foot. And the patient is asked to lie on the couch fully on supine position. The major risk on the foot in sports person is ankle sprain. For that, the ligament is the most common reason. For preventing that sprain, the major reason for the ankle sprain is due to ligament lesion. but we may prevent by strengthening the or stretching the muscles. The stretching of the muscle is about peroneus compartment muscle. Passively dorsiflexion, passively plantar flexion and inversion results in the peroneus compartment stretch, which may prevent the ankle sprains. And also the stretching of dorsiflexor muscles of leg also results in the prevention of injuries in the ankle. The repetition is about as previous, 10 to 20 seconds hold, 2 to 5 sets. Then we are moving to calf muscle stretch. Passive dorsiflexion of foot will result in the stretch of calf muscle, gastrocnemius and soleus, to prevent the injuries in the calf. Thank you.